Welcome back to Politics Tonight, everyone. Dr. Salma Anas is still on the program with me tonight. She's the special advisor to the president on health. And tonight we focus on the health implications of flood-affected food items. Dr. Anas, thanks a lot for staying with us on the program. So as someone who is so vast in the delivery of quality health care to vulnerable people in humanitarian crisis, what challenge or challenges does this pose to the federal governments, leaving out the state government for now?
Yeah, it has a lot of challenges to the federal government. Hello, can you hear me? So apart from what we said, there are also mental health implications, and also there are disruption of existing services, like people that are already on with chronic and underlying illnesses such as diabetes, hypertension, HIV, and several others, including cancer care. Services have been disrupted. So, and then if you go to visit the teaching hospital, there have been massive destruction of medical equipment. There is a new cancer center that has one of the best equipment for cancer treatment and care in the teaching hospital. It's a state-of-the-art. In fact, it's one of the best in the sub-region in Africa. And this has also been affected by the flood disaster. The CT scan machine, the radiotherapy equipment, the radiodiagnostic. They even have a diagnostic machine there, radiotherapy machine, that you can also do surgery on patients. So at the moment where I was made to understand by the chief medical director, already about 80,000 patients are on treatment at the moment on cancer, and this has been disrupted. So you can imagine the catastrophe of this and the effect of this on the cancer patients, which means that they have to be transferred. So a lot of destruction has happened. The emergencies units within the facilities has also been destroyed. And this is the state-of-the-art referral facilities in Maiduguri Teaching Hospital that does not only serve the people of Maiduguri, but its environs and also beyond. Even some states, the Federation, do access their cancer care in Maiduguri. So this has serious implications in terms of what has happened, because this has to be replaced. And I'm glad that His Excellency President Bola Ahmed Tinubu was there physically himself. The Vice President of the Federal Republic of Nigeria, His Excellency Kashim Shettima, was also there, and they've seen the extent of damage that happened even within the health sector. And he has committed also to intervene and ensure that special intervention funds are made available to restore services in the state. So government is committed to it, and the president has said it categorically that we are going to restore services. And already some of the manufacturers and those that install the equipment are already on the ground doing an assessment of the extent of such damage in the facility at the UMTA, that is the University of Maiduguri Teaching Hospital.
All right, so I know you say interventions have been coming, but I can only guess that these are financial interventions. So are you advocating for more support to complement government efforts to deliver life-saving treatment to these people, especially malnourished children?
Yeah, a lot of support have been mobilized in addition to what the state is doing through the existing system that exists in the state. So as I said earlier, a lot of support has gone through. Also, the Ministry of Health, through the coordinating minister, has also intervened in that, and then through the program that already exists. And then malnutrition, already there are centers within the states that cater for malnourished children and other under 5 children. So all those facilities are currently being strengthened. And then human resources also, the University of Maiduguri Teaching Hospital are also redeploying human resources to support the whatever services that are required within the communities, and also the IDP camps, and also the existing health facilities. So we are also benefiting a lot from our partners. A lot of partners are in WHO, the UN agencies. Some implementing partners are already there, are also providing massive support to ensure that we restore services as quickly as possible, because there is need for immediate interventions to avert any outbreak that could happen, and also long-term effect, including mental health of people. The facilities, there's already in place a neuropsychiatric hospital, and then counselors are already there. So there is need for massive counseling of people, because people have already gone through a lot of psychological trauma anxiety, fear. Some have even gone into depression, and this can exacerbate also some existing mental health problems that already exist. So there is need for all forms of different healthcare services to be made available in Maiduguri at the moment, and I'm glad that a lot is already happening, but of course there's still much more to be done, and we are still inviting as much as possible, not only government, private sectors to also come in and support the state. And I believe that with also support of private sectors, especially in the health sectors, we'll be able to quickly track progress and reverse the situation.
All right. Dr. Anas, allow me to deviate a bit. I want us to talk about structure of the healthcare system, health management system in Nigeria. The president unveiled a plan for massive investments in health coverage. What promise does this hold for the country?
Yes, so I'm glad to talk about it, the renewed hope health agenda of President Bola Ahmed Tinubu. As you know, health is a critical component of his agenda, which is a part of the overall national development of the country. So the massive investment, of course, it also includes government allocation and also bringing together all development partners and support and putting them all in one basket so that we have a holistic approach and also harmonization of all our efforts to ensure that we maximize the effect of the resources that we have in the country towards the same goal, towards the same vision and aspirations of President Bola Ahmed Tinubu's renewed hope health agenda. So this is already flagged up, and this is not only at the national level, but also with the buy-in and commitment of sub-national government. And you're all aware this happened last year, where all the governors also signed a compact, and which means they've agreed, they've aligned to the vision and aspirations of His Excellency President Bola Ahmed Tinubu, so that we have one approach, and then we'll harmonize all our resources towards the same goal and deliver, and access, so that every Nigerian will have access to healthcare services, irrespective of where you are. Vulnerable people, women, children, elderly will have the same level of healthcare services wherever they are. So this has been done, and part of it also, we have the global health security, which is the emergency response. And it is part of it is to ensure that we are well prepared. We have the readiness for response in terms of whenever anything happens, either an epidemic or diseases or any epidemic that will come or any pandemic, just like what we have witnessed in the past around the COVID pandemic. So it requires a lot of system strengthening, not only at national level, but also at sub-national levels up to the local government level. It requires capacity development so that the health workers will have capacities developed and they will be able to respond promptly. And also it requires effective monitoring and supervision, and then feedback through data. So those are the systems that have been put in place by His Excellency.
As implementation started, Dr. Anas, has implementation started? Because I know as of January, the program was in two parts: unveiling of the Health Sector Renewal Investment Initiative and the signing of the Health Renewal Compact by federal, state governments and development partners. So has implementation kicked off?
Yeah, implementation has started. Implementation has not stopped. If you may recall, the Basic Healthcare Fund started about 2 or 3 years ago, and this has continued. So this administration has increased the level and increased the funding for the Basic Healthcare funding, and also scale it up from addressing, targeting 1 primary healthcare facility to now 2 primary healthcare facility per ward. So this is already ongoing. It has not stopped, but it has also increased. And you are aware that capacities have also been developed and is still ongoing of healthcare providers at the lowest level, and which are called the frontline workers, in addition to already ongoing activities in the country. So I would say that activities has already started, of course, implementation, and it has continued on whatever has been existing in the past, and we are also scaling up to do more beyond that. So this is happening, and also at the sub-national level.
Let's expand this conversation, because the president also announced plans for a comprehensive revamp of physical infrastructure and equipment. Talk to us about the state of things and what level is that as we speak.
Yes, there's a scale-up. You are aware of the oncology, that is the Cancer Treatment Center. Recently, it has been launched. And there's an expansion of that cancer care in all our tertiary institutions in the country. And this is also ongoing in our teaching hospitals. And as I mentioned, this is part of the devastating effect that affected the University of Maiduguri Teaching Hospital. It's one of the cancer centers that has been upgraded with state-of-the-art equipment. And also other facilities have also been expanded. And this flood disaster has also grossly affected that center. So now we may have to find another opportunities, because you can't cut off and disrupt patients that are already on cancer care. They have to refer to other facilities that they can continue to access services while efforts are going on to revamp and restore, or in some cases, we may have to install new equipment and diagnostic facilities at that center. So a lot is happening at the same time. I think I can talk about that at all the levels, at the tertiary level and also at the primary health care level. A lot of activities are going on at the moment across the country.
But what about plans to train additional human resources for health from 2024? Because I remember that in August, Mr. President launched the Nigeria Sovereign Investment Authority, which encompasses healthcare expansion program and the retraining of 120,000 frontline health workers. But many have been wondering, how can this be achieved in the face of brain drain in the sector?
So addressing the issue and reversing brain drain is one of the major agenda of His Excellency, President Bola Ahmed Tinubu. And the Ministry of Health is pursuing that. A policy was already launched on the migration about a few months ago, on migration, on how do we quickly reverse that. So what has happened recently from that time till today, there has been massive efforts to increase production of health workers in Nigeria, both across medical doctors and also nurses and midwives. So there have been also accreditation of some new institutions, including private institutions, so as to increase the capacities and the training of nurses and midwives. And also existing institutions, their capacities have also been increased to allow that. And then a lot of negotiation is also going on, and improvement in our facilities. And there's a negotiation is also going on to motivate our health workers and also to improve their working environment. So one outstanding thing that I saw also happen as a result of a lot of advocacy that has happened, even at a subnational level, like Borno State, they've also increased allowances of their the healthcare providers that are working at the rural local government area and rural communities by about 30%, and that is highly commendable. And in some instances also, they've also, like Borno State, I've seen that they've increased also the retirement age to 65. And those are some of the measures we can also take to increase retirement age, so that health workers that are above 60 can continue to be productive and continue to provide services in the country. So a lot of negotiations are going on in the countries, and then federal government is also playing its own part where necessary. But a lot needs to be done, as I said, by the subnationals.
But, you know, because we can agree as a people that sustainability and maintenance culture have been some of the challenges facing the health sector in the country. So how do you think this can be managed when the initiative is fully implemented?
So yeah, sustainability has always been a challenge, and we have to institute, that is why institutionalization is very significant, and also ownership, because it's not just bringing this equipment, signing, and then that is it. But there must be a sustainable measure that will be put in place, and then the state also have to own it. And they have to have a sustainable plan, they have to have a budget for it. And we have been advocating aggressively for increase in budgetary allocation for health, you know, beyond what is currently happening. And federal government has made such. His Excellency, President Bola Ahmed Tinubu, when he came on board, he was able to increase allocation modestly to a certain level. And then we've also advocated to a lot of state governors. Some of them have increased up to 15%, some 10% and above. So that ownership is very significant, so that they see the value of whatever is happening within the health sector and continue to maintain it and sustain it over, forever. It's not something that needs to stop. So that's one area also that we have seen that we are promoting sustainability is also especially projects that are being supported by development partners. So we need to own those states. We need to also have budgetary allocation for them, and then we need to ensure that they are fully institutionalized within our systems, healthcare systems at all the levels, to ensure sustainability.
Right, but on the other hand, what role can health personnel play in ensuring success of these initiatives?
Well, health workers are very critical to it because without the human beings to deliver the services, it cannot work. So they are a critical component of it in terms of, if I get you right, yeah, so they are a critical component of it. They play a very key role. And I was at an engagement today with the associations of health professionals because they are stakeholders and they play a key role, in enlightening and doing a lot of advocacy and participating in policy development to ensure availability of those services and also sustainability of those services. So a lot of efforts are also again going on to bring on board healthcare professionals, their associations of healthcare to be part of the decision makers, to be part of, ensuring continuity of project, not just also implementation, but they also have a key role to play in policy formulation, policy development, and also monitoring, supervision, and providing all the oversight functions into the efforts that are going on.
Dr. Anas, taking a look at efforts made by this administration to provide policy regulating salt in commercial food. I remember you said that reducing salt intake is the most cost-effective measure to reducing public health diseases. Where are we on these regulations?
So yes, and this falls under the overall umbrella of the efforts of His Excellency President Bola Ahmed Tinubu to ensure that we promote, we also educate and we protect Nigerians, from coming into contact with all forms of disease so that they stay healthy and also healthy lifestyle. So there is, as part of the efforts to ensure a healthy lifestyle, we're target, in fact, all the three white elements, salt, sugar and flour. So there are efforts to ensure that we understand the dangers that are within consumptions of salt, because one of it is about hypertension. It's one of the major causes of ill health, hypertension in Nigeria across the age. We are beginning to see even young people presenting with hypertension, and in most cases they are not even aware they are hypertensive, which leads to cardiac heart problems and also a lot of implications on the kidneys. So the best is to protect it, and a lot happens because of increased salt consumption, because studies have shown that Nigerians take much more salt beyond the recommended WHO, because you are supposed to take not more than maximum of about 5 grams, per day, but Nigerians are taking up to 5 grams and above, at least less than that, or 2 grams and below. So, and most of this is not just about the salt that we cook, but also the table salt that we sprinkle on our food while eating, and also the salt that is also used for storage, for preservation of some of these food items. So there is need to campaign so that we understand the dangers, Nigerians understand the dangers of consumptions of high salt, because it will go a long way in reduction of a lot of ill health in the country, especially. So
how much awareness has gone into, how much advocacy has gone into creating more awareness on this?
So this is currently ongoing, and it's embedded in all our health promotion structures in the country. And then we are building the capacities, we are training, and then we are also creating champions that will be talking about it across board, especially young people. They should be aware, they should talk about reduction of salt intake. And also the work is ongoing to ensure there is a regulation. A policy document is currently being developed to ensure that there is a regulation on intake of salt. And this is being led by the Federal Ministry of Health and its parastatal NAFDAC. So to ensure that we enforce and regulate the salt intake in our food, packaged food, all forms of food, there is need for Nigerians to be aware that you don't need to take so much salt. Most of the food items we take, we don't need to even add more salt to it. They come with their natural taste, so without any addition, you can just have it. But it's about training the taste buds to know that you don't need to add salt on that, and knowing also that the implications far outweighs, taking the salt, because prevention is better than cure. And the implication of having hypertension, which is a silent killer, it's very expensive. It's very expensive. And the implications, the consequences, the complications on your system, the heart, the kidneys, and everything of you, I mean, it far outweighs not taking salt. So this is why we are campaigning, and we are partnering with different stakeholders, community people, religious leaders, different categories and tiers of our people within our environments, to educate them. Even health workers, it should be an integral part of messages. When people come to the hospital, patients come to the hospital, they should have access to that information. But even outside the hospitals, a lot of messages will be disseminated, and are already going on, either through all forms of media platforms, to ensure that people know the implications of salt intake, excessive salt intake.
All right. Before we leave tonight, let me take you up on primary healthcare system. I would like to know what government is doing to strengthen our national primary healthcare network. What has been done to make sure that nobody lives more than 3 kilometers or 30 minutes away from a primary healthcare facility?
Yes, so this is one of the commitment and the aspiration of His Excellency President Bola Ahmed Tinubu, to ensure that as part of efforts to attain the universal healthcare coverage, where no one is left behind, we can only achieve this through a strengthened primary healthcare system. And what we meant by that, everybody should have access to a functional primary healthcare system within their community where they live, at least not more than 3 kilometers walk from where you live. And that facility, we were promoting 1 PHC per ward. Today we've gone beyond 1 PHC per ward, and we are promoting about 2 PHC per ward. Functional, in terms of functionality, is not just about the building. You can have a small building but has everything that is required. So you need to have the required human resources that are there to deliver the services. Basic minimum equipments, basic medicines, supplies, consumables within that facility that will be available. And that facility must run for 24 hours a day. But most importantly also, it has to be protected, it has to be well secured, it must have infrastructure, it must have clean water supply, and also it must have electricity to keep it functional. The labs must function effectively, the delivery rooms must work effectively. So this is what we meant by this. And the government, His Excellency, has made provision for that through the Basic Healthcare Fund, and it has been also an increment in the allocation for the basic healthcare. So all states of the Federation of Nigeria are beneficiaries of the Basic Healthcare Fund at the moment, and it is aimed to strengthen our primary healthcare facilities. At least 50%, about 50%, 45% of that is going into system strengthening of the primary healthcare facility. But of course, it differs from one state to the other in terms of their needs and also in terms of commitment of the subnational government. So some can even go beyond 2 PHC per ward, and then depending on how they want to design it and also the facilities that they have. But the minimum standard we're promoting is at least 2 PHC per ward. And there must be an effective referral system between every primary healthcare facility to the next level of care, which is very effective, and also linked with an effective ambulance systems and emergency ambulance systems. So in case there are referrals, it will refer to either the next level of secondary health facility. And remember that there is always an existing in all states of the Federation, a tertiary institution. Whether a federal medical center or a teaching hospital does exist that deals with highly complicated cases and also provides support to that primary healthcare facility in terms of capacity building, in terms of mentorship, and also hands-on experience, and also provision of services.
All right. Dr. Anas, whenever I have conversations about Nigeria's healthcare system, I'm always very particular about unlocking healthcare value chain. Sadly, we have become net consumers of health products manufactured from outside of this country. So I'd like you to talk to us in very few minutes. Talk to us about the president's new initiative to attract substantial new investment into Nigeria's healthcare system, stimulate local manufacturing, reduce drug costs, and implement other transformative measures.
So His Excellency President Bola Ahmed Tinubu is very concerned and committed that Nigerians should be able to produce our own drugs, our medicines, our consumables, assemble even our basic equipment, and assemble even some sophisticated equipment in Nigeria. And by that, he has made a lot of commitment, and he has demonstrated. He has passed a lot of executive order that even takes away, waive tax on importation of some of these elements and importation of active pharmaceutical ingredients into Nigeria. So this is part of efforts to create an enabling environment for the potential manufacturers in Nigeria and also those that are already manufacturing. And then it also creates an enabling environment for those that we can attract foreign investors in Nigeria to come and produce in Nigeria. So all these efforts are ongoing in terms of creating the enabling environment. And we are also increasing and supporting those that are already existing to produce all those pharmaceuticals in Nigeria, including vaccine production in Nigeria. And part of the effort that have also been made, which we started much earlier, is, of course, Nigeria today is a hub and a center for Africa CDC. We have the regional office here in Abuja in Nigeria. And a part of their efforts also is to support local manufacture, you know, to also change the dynamics at the global market and shape the market so that Nigerians will also be able to produce not just production for consumption by Nigerians, but also exportation.
All right, Dr. Anas, sadly time is against us.
Especially within the African continent. Yeah.
All right. Sadly, time is against us, but I'm sure we'll have this conversation some other time. Thank you so much for coming on the program. Dr. Sama Anas is the Special Advisor to the President on Health, and tonight we focused on the health implications of flood-affected food items. Thank you so much for joining us, Doctor.
Thank you. You're welcome.
And thank you so much for watching, everyone. That marks the end of today's episode of Politics Tonight, but you can watch the repeat broadcast of this episode at midnight. Get in touch with us on our social media handles, Facebook, Instagram, and X at TVC News NG and at Olajumoke WO using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News Nigeria. I am Olajumoke Olatunji. Good night, everyone.